Class, with this lecture, we're just going to continue talking about mood disorders. We're going to look at the multipath model here and treating mood disorders. So when it comes to this multipath model, this is the basic framework that we use in psychology for treating any and all mental disorders. So we call it a model because, as you can see in this chart, it is composed of different factors that have influence on us. Those are, biological factors. We talked about those in the last video, the first part of our lecture. We have psychological factors. So that's going to be, how your environments affect you, whether you had those positive regard or you didn't have positive regard. No, it's going to affect, psychological dimension is going to affect the way we think, getting stuck in those negative feedback loops. It's going to be it will involve the ways that we learn, the ways that our personalities form. And then we look at those sociocultural dimensions and social dimensions. So those social culture, they're going to be things like our genders, how our cultures raised us. It's going to be sexual orientation, things like ethnicity, our belief systems or religion, if you want to call it that. Those are all social cultural dimensions that play a role in our personalities and how we engage others. And so when it comes to our brains getting sick, it's more those negative things associated with the socio cultural dimension. So things like discrimination, bias, stereotyping, that is going to affect somebody's mental, emotional, and spiritual mood, right? And then last, we have social dimensions. And those social dimensions are what create those psychological, those mental things that come up, those negative, those, and feeling those negative feelings. Those social dimensions are those outside not resources, but outside influences, environmental influences. So it's going to be, your social support, your resources, or your lack of. It's going to look at your background and how you, neglected, were you not neglected, were you used as a child, or the traumatic things that had happened in your life. And so we see with this chart, each of those dimensions are separate, yet we have these arrows that connect them all together. Because when it comes to being human, when it comes to our mental health, be that on, the healthy range or the unhealthy range, we're always, it's always going to be something holistic, because as humans, we don't live in isolation, right? And we have all this different stimulus that's always coming at us, and that's going to affect us. All right. And then, of course, the more stressful or traumatic event we experience in life can lead to those real intense feelings of depression, and basically leads us to having low self-esteem, low self-efficacy. So it's hard to develop secure and trusting relationships. And, sometimes when we get to, this point of depression, we tend to isolate ourselves. So, of course, that's another factor to think about, even just as, not psychologists and just normal people, when we look around at our friends, coworkers, our loved ones, and, we may be able to be that positive influence there. But like I already said, we're never going to change anybody else. The key there is to help that person find what motivates them, or just like we like to do in psychology, trick people, You got to trick the person into thinking that they came up with the solution to fix themselves, because that's really the ultimate goal. When you can get the client that is looking for help, when they're open enough to want to be to that help, it's definitely a lot better when they feel like they have more control over that than just somebody trying to tell them or trying to force them to do it. Right? So when it comes to depression, we have to go back and think about those different dimensions in that multicultural model there, right? And we know that different groups experience depression in different ways. Okay, so when it comes to emotions, of course, we all have happy, sad, disgusted, surprise, and fear. Those are, like basic emotions. Even animals have those emotions. And so when we get into other things like guilt, shame, what would be, and, maybe ambivalence or bemusement, like those are all secondary emotions. And those are ones we experience in different ways because, it just is contingent upon what those cultural rules of engagement are. And so, a lot of times, probably, I'm just going to go ahead and say it. I don't feel like I'm generalizing here, but, the number one reason people don't get help when they're going through, mental health issues is because of bias and discrimination. And, we live in a culture and a time in the world where we're not just so, we have all this stimulation coming at us all the time, but we have a lot of information. That's pretty much what information is. It's just all information. And not all that information is good, right? Because of movies, because of biases and discrimination in the past. We kind of hold it in our genes. And then at the same time, we still see these things being perpetuated in society. And, and from an historical, anthropological, psychological perspective, it's like we learn about these types of things. We learn about discrimination now. We learn about it in the past, so that we do find those positive ways to overcome it. And I really think, as a culture, the United States, we're still very young in our evolution because we basically have just came out of the age of segregation and discrimination and the Cold War era. And that time period from the we'll just go with the 50s to the 90s there, when first Bush got into office in the United States as president. That's kind of when we see the Cold War ending. So technically that means we're still we're in this post Cold War stage of society. So, we're still learning how to rebuild our society and create trust among the different groups there, right? So, like we've already noted, we seem to see that depression is more common among women than men. And, of course, there's a little biological support for that, because we do, I don't know how to say it, dysmorphic disorder of women, menses, does play havoc on transmitters. You know, our bodies changing, and those chemicals in bodies change. Those can have some negative consequences and pose challenges for some people. And then, even though it seems like we see more women being diagnosed with depression, I would that it's not that more women, it's not that women get, I think it's just that we are culturally taught to deal with emotions and with mental health different ways. And so it's just more women getting treatment than men. I would hypothesize that men probably, or that there's probably not much of a difference there as far as levels of depression among the genders. I just, like I said, I think it's who is reaching out is the only that's the only disparity we see there. And also, again, men and women are taught to deal with emotions and just behaviors in different ways, right? And so, medication, especially when it comes to disorders, medication is extremely helpful because, once again, we have to look at that biological influence for mental disorders, especially when it comes to things like depression. There does seem to be something going on with the neural connections and those chemical reactions we have in our bodies, like something's wonky with those and out of whack. It's either you're getting too much this hormone or neurotransmitter, or you're not getting enough of it, or it's just out of control and just spiking all over the place. So it's like erratic. So not really too much or enough. It's just kind of erratic. And so antidepressants can help some people with their depression. So, that's a good thing. We just have to be careful there because pharmaceutical companies want to push all their medications and they don't necessarily all have positive effects. And in fact, most of the side effects, in fact, like 90% of side effects of prescription drugs don't come out in the trial phases. It's not until they start getting distributed to the mass population that we start to see those side effects. And, that there's a lot of different factors for why that is. But medication can be helpful in some circumstances. It's just like anything else in life. We have to be discerning and, and empower ourselves with the knowledge and the experience and the information to be able to discern whom needs the medication and who would benefit from some type of other treatment, right? And now, there for a long time, treating every problem with medication was the norm for psychology. And then, just like with like I said, the end of the Cold War era there, so about the 80s, the 90s, psychology changed and we started going more to alternative types of therapy and more like combinations of therapy because there's no one quick fix solution for everybody. So just like anything else in life, we've got to take that holistic approach. We have to look at all the different factors, all the resources and tools we have available to us, put those together in a model, we can say, that will help guide us into, helping people the best we can because as psychologists, that's ultimately what we do, in a business and a profession that helps people. And so we try to always stay open to all and there is definitely treatments for depression that's related to our circadian rhythm. So, sleep patterns, changing sleeping patterns help. Then, of course, we have different types of brain stimulation therapy. So let's think back to the neural connections, those chemicals in our brain, which are transmitters. So a lot of time with mental disorders, what we're seeing is that there is a disconnect between that system, that neural transmission there, right? So something's going on to where that the connection's not being made. Maybe the circuit is being overloaded, and so sometimes brain stimulation can help. There's things like transcranial magnetic stimulation. That's kind of cool if you've ever seen one of those machines. It's pretty much just like massaging your head, kind of. It is what it does. Even though I don't think it vibrates, but I think because of the magnetic stimulation, it's like if you rub your head with a balloon and you kind of feel the electricity. It's kind of like that. And then like vagus nerve stimulation, electroconvulsive therapy. Now, of course, electrotherapy is controversial because it can really damage the brain if it's not done correctly. And I'm sure any of you guys ever watched any kind of scary movie, they a scary movie in some kind of insane asylum, they always go to the electrotherapy, right? Electrotherapy is helpful for bipolar disorder and maybe even schizophrenia. But we have to be careful with that. 'Cause like I said, it's kind of it helps the brain as much as it can hurt the brain too. So once again, that used to be something in the past that psychology, you know, give everybody shock treatment so they would make them all docile and didn't really have to deal with the patients. That was some of the abuse and mistreatment going on there in mental institutions, and it is still used today. And but like I said, they're getting a little more discerning and just using it for those most extreme cases. All right, and then next we have behavioral activation therapy, and pretty much what this is just you're exposing the person to things that are happy, things that are pleasurable, things that are going to help naturally increase dopamine in the brains, right? And so, in order to do that, you have to figure out what that person would consider a pleasant social interaction. And then, you just take it one step at a time. And that's a big part of treating or mental illness too, is that as a therapist, we have to take it one step at a time. And then as the patients, as the clients, we have to make sure that they stay task oriented, as in, take it one step at a time, because you don't want to hit somebody that's coming in for help with so much that you're going to exacerbate what is going on with them. We want chunks, and then you have to realize that with everything in life, there's always going to be some relapse too, and that's just part of the learning and growing journey in life for all of us. We all have times that we fall down on our face. The good thing about getting proper assistance with mental health issues is that you're creating a support system and a network of tools and resources that are going to help you when you face. They're going to help you get back up and make that next little part of your journey a lot easier. And then, of course, what is that going to do for the client? That is going to, we want to help, and goal is goal for all of us is to be those positive, as positive and productive in life as we can be, and try to be the most efficient and productive agents of social positive change. And so, that means in our listening skills and our communication skills, and how we go about handling conflict and dealing with other people, how we go about handling our own internal conflict. And then, that in turn is going to help us increase our social skills. And, maybe you're kind of an introverted person, or maybe want to, maybe a little more loner type person. And so you have to take those kind of things into account when it comes to treating these disorders too, because what does increasing social skills mean? Doesn't mean you're going to take somebody who like would rather just sit at home and read and turn them into like a party animal. I mean, it's like you've got to work it out with that individual client of how they achieve these goals. And then, baby step by baby step on accomplishing those goals. And then, provide that positive reinforcement because goals aren't always going to be accomplished, right, guys? And that's okay. That's part of the learning and growing journey in life. You don't accomplish a goal. That just means then you regroup and you figure out another way. And, you want to figure out the way that's most positive, productive, and efficient for you. And of course, CBT, CBT, cognitive behavioral therapy, is actually on the rise, improving itself. The very useful treatment, and it's all about changing those negative feedback loops, and it's about those steps to understand, what triggers, what is that trigger causes you to those negative thought patterns, those emotions, maybe people, situation, and how you can go about identifying those and handling those. And, guys, whether you have a diagnosed mental illness or not, this is good advice for every one of us in life. Have negative feedback loops. We all have a shadow side to our personality, part of the unconscious part of our brain that controls all our behavior, not subconscious like everybody likes to talk about. That's wrong. Freud and Jung and psychologists that came up with this whole brain being conscious, unconscious, subconscious. Our subconscious is like your basement where you throw all your. If you really want to get into the nitty gritty of your personality and behavior, you got to throw up to the floor. You got to throw up to that subcellar. And that subcellar is scary because it's a dark cavern that you have not explored all of, and that's where your inner demons and monsters hide. And so, if you make it down to that level of that's where the true healing comes in. And, once again, we just simplify it. To stop those negative feedback loops, we have to be aware on. And once again, guys, we have to always be kind with ourselves because even though you know how to do this, okay, maybe you've done CPG therapy, maybe um, you have your own technique for changing your negative feedback loop. You know that sometimes you fail, sometimes you can't make it stop, right? Sometimes you just kind of have to ride that wave out, okay? And that's okay too. That doesn't mean that you give up. It's like, okay, you once again, you regroup, you find the resources and the tools that will help you deal with that more efficiently the next time that negative, because the more you can identify it, the more you can say, hey, stop. And the more you can do that, then, that is to change. It's like, feeding the negativity. When you stop feeding the negativity, it will starve itself out. All right. And then things like mindfulness based practices, which is, of course, kind of my specialty. That's one of the main things we do here on the farm and with the and the other animals. The main goal of our goat therapy is just to teach people these basic life skills and basic psychology skills that help all of us learn how to deal with stress. So, I'm not a licensed psychologist. The goats are not licensed psychologists. We do not treat and diagnose mental disorders. We simply just give people these like I said, we teach people a lot of stress management and a lot of mind things like just learning how to meditate with animals and to meditate out in nature and just let go of all your stresses. And we do things like goat yoga so that people are getting those benefits from yoga, that all those physical benefits, and then they get this like double bonus because they're doing it with the animals. And we have scientific evidence that being with animals, especially goats, they raise our dopamine levels, they help decrease our cortisone levels, and then most importantly, hanging out with animals like goats puts us in just a better mood. So mindfulness is just about learning to slow down and focus on the moment. And, once again, it's another way that we can go about changing those negative feedback loops. And, once again, we have to be kind with ourselves in that process because, guys, and actually, if there's any one of you out there that is perfect and you've got this all right and none of this affects you, please email me and let me know because the rest of us are not perfect, and we're trying the best we can, and that's all that we can do. Yeah, someone's got to figure it out. Totally, totally let me in on the secret there. I want to know. All right. So we're almost through with this part of the lecture, guys. So now we are just going to talk a little bit about bipolar disorder. And if you guys remember from the first part of the lecture, I was talking about how any mental disorder, in any behavior in life, any emotion we have, any, spiritual state, they all exist along a spectrum. So you're going to have the least severe to the most, extreme cases. And when it comes to psychology, especially abnormal psychology, we're more interested in those extreme cases, because those are the group that need that extra support and help. But all of us can experience depression. All of us can experience hypomania or mania. Now remember, hypomania, mania, these are these periods of arousal that can happen. For some people, it's a high state arousal, which means their brains are going haywire, so they're like bouncing off the wall, right? For other people, their brains can be going haywire and they can maybe just sleep in bed, not get out of bed for a week, So it's once again a spectrum, and so hypomania is less. It's even though it's hypo, it makes you think it should be, the arousal signs are extreme than in say a mania episode. They're actually not. Mania is when you really see those extreme behaviors. And once again, this is when you really get into the debilitating factor of mental illness. And these hypomania mania episodes, they're going to be alternated with these episodes of deep depression. And so, when that is bipolar disorder. And so, you know, I think maybe a kind of a misconception with bipolar disorder is like you're always happy or you're always sad. There's kind of like no in between ground there, right? And it's not necessarily that. It's just once again think of the spectrum, and it's you're going to these extreme behaviors that are bipolar, meaning they're on opposite sides of the spectrum. All right. And it is going to involve sadness and happiness. And, it just once again, depending on the severity of it, is how that disorder is going to play out on the individuals. It seems to be that the onset of bipolar peaks in teens and early 20s. And, once again, this is, our brains are not fully developed into our early 30s. So our teen years to our early 20s, these are formative years that our brains are still developing, our hormones are still developing, our neurotransmitters are still developing. So, when something gets out of whack there, brains, then and if you already have a genetic predisposition for this mood disorder, then that's when you're going to see it with it basically what it means by peak age is like this is when it's going to come on and it's going to be most intense. All right, and so bipolar, when it comes to diagnoses, it's when the assessment confirms that there is that hypomania or mania. So someone comes in, you see these depression symptoms, and then they have the hypomania, they have the mania, right? And then you also want to take into consideration the frequency of the mood states. Of course, then the severity, chronicness of those symptoms are going to play a factor too. And just like with the other mental disorders, when it comes to bipolar, we break it down into three main disorders. So we have bipolar 1, bipolar 2, and cyclothymic. And bipolar one, you can either have or not have a history of depression, but you do have those manic episodes, which would be that hypomania or the mania, worst case there, right? With bipolar two, this is where you have this is where it's more pronounced. So you're having those depressive episodes. And you're having those manic episodes in conjunction with them, right? And it's a more consistent pattern, so it's more chronic. It's getting into that more chronic, more debilitating state. And then you have cyclothymatic disorder, and so with this one is probably more of that stereotype of bipolar that's just happy sad. It's the what oh, grief mask they use. One the happy face and the other one's the sad face, but that would probably be the cyclothymatic, because you are seeing it's a it's more of a pattern. So it's more consistent to where it's like something like seasonal affective disorder. So we know that when it starts to get cold, we just had time change, right? So we just had the time change that starts to affect people's mood states, and then it affects our mental, emotional states and our behavior. So it's cyclic. We know it happens every year at that time, just like we know flu season happens every year at time. It's a cycle, it's a pattern of something that is consistent in someone's life. And then in this slide, we just see a chart of our three different disorders, giving us that DSM criteria, pretty much our lifetime prevalence, which is just like the percentage of the population affected. What are the gender differences there? It is interesting to note that when it comes to bipolar 1 and cyclothymatic disorder, that we don't seem to see any gender differences, not like anything that's really profound. And then when it comes to bipolar 2 disorder, it seems to be more commonly diagnosed for women than it is men. And once again, I'd argue is that just because more women are coming to get treatment, or is it truly because, women are from Venus and men are from Mars? And then, of course, we have our age listed last on the chart. And like we said, of course, late to early 20s, those, still formative brain development, hormone, neurotransmittal developmental years are when we most note these disorders. So once again, when it comes to bipolar disorder, it's really debilitating because you're having it's like you're just constantly having these up and down episodes, and the more you have them, the chances of them getting more chronic, more severe, of course, is going to happen. Because remember, once again, when it comes to bipolar disorder, you guys should remember this from the first part of the lecture, it's a spiraling effect. So if you're not getting help for it, it's just getting worse and worse and worse. All right, and then there is just a breakdown of that prevalence that we just saw on our chart. So basically, for bipolar 1, it's about 1% of the population, just a little over 1% for bipolar 2. Psychosomatic is, about a half to 1% of the population. And we do think that bipolar may be underdiagnosed. Once again, I would agree with that, because most people are just not willing to go out and help, or when someone is not trained, hard to motivate them. That's the thing there for people get mental, is you got to find the motivation. And then when it comes down, let's just go with the whole world population of 8 billion. How do you motivate 8 billion people? I'm not really sure. It doesn't seem like we found ways yet, considering the number of conflicts we still have going on, right? All right, and then once again, when we go to our etiology, so basically, etiology is a fancy way of saying the root causes. What is that root cause that is creating the brain to get sick? And as we already know, we already talked about, just like with depression, since bipolar is a type of depression, not depression, but mood disorder. We know that there are genetic components, and a lithium is a one of the number one ways that bipolar disorder is treated. And then there can be and those biological factors, once again, hormones, neurotransmitters are actually going to play a role there. Remember, you're going to have too much of that, and that connection, that electric connection in our brain is just going to be doing all sorts of wonky stuff, right? And so when it comes to bipolar disorder and treating it with medication, so for most depressive disorders, even anxiety and kind of stress disorders, the SSRIs, they're selective serotonin reuptake inhibitors. So it's related to the serotonin flow in our bodies. It's somehow it's either not getting enough or you're getting too much. So the SSRIs help regulate and balance that out for you. But because everybody is different, sometimes those SSRIs can actually trigger the symptoms as opposed to and it's important to have that background, that knowledge, that knowledge, that experience, so that you make the most discerning, so that you help make clients make most discerning decisions there, as in, you're really figuring out what is going on, flexible, so that you can change if you need to be. And then sometimes when it goes to bipolar disorder, once again, I think because of the biological genetic component there, if you have that gene and something very stressful happens to you, that then is going to activate that disorder. And way we go about handling the positive and negative information in our life, our memory of that, the emotions associated with it, that's all going to play a role in our brains getting sick. And when it comes to bipolar disorder, it does seem to be that biopsychological, and there's definitely something with actions in our body that is causing our brains to get sick this way. So, all right. So sometimes bipolar is confused with schizophrenia because we see some of those neurological irregularities, all right. And we also see some of those genetic factors that will contribute to both disorders. And we see similar abnormalities in the gray matter of the brain, as well as deficits in cognitive and even things like communication functioning, but they're not the same types of disorders there. All right, so when it comes to treating bipolar, like we said, it seems that medication does a good job because it really helps like those neurotransmitters and hormones. However, as I have mentioned before, psychology, we're not so much about just throwing medicine at all these disorders nowadays. We take a more holistic approach. And so, sometimes, such as with bipolar disorder, a combination of medication, psychotherapy, and psychoeducation are most positive and productive treatment. So, combining those two in a combination. And psychoeducation basically is just helping the client understand their disorder. It's just that it's educating them on what their disorder is and making them feel like they have control. They have a level of control in what is going on with them and how they can go about helping themselves. So it's helping them find the motivation. And so, a combination seems to be most effective. And then sometimes you have to kind of medications there. Lithium, as I already mentioned, seems to be the most effective when it comes to bipolar disorder. But the thing about medicines like this disorder is that, there's already something chemically going on in the body, in the brain. And so when you're taking patients, you're getting that balance of those chemicals right. And so when you don't take your medication, you can cause further problem challenges for yourself because your chemicals were already out of whack. You're taking your lithium, you're getting it balanced, then you forget to take your lithium, and now you're like all out of whack again. And maybe in some cases it's going to be because you've got that stable flow and now it's out of whack, and so that can really exacerbate symptoms too, as well as side effects. And then when we look at those social cultural features, once again, that psycho education and a lot comes to mental disorders, they're not an individual, they're not just specific, and they don't just affect the individual, they're going to affect the family too. So a lot of times, if you can get the whole family, or at least that immediate environment, people in the immediate environment involved in the therapy process, bottom line, it's just to make life easier for everybody. And then, of course, interpersonal therapy, kind of like talk therapy. Interpersonal, it's about, really going inside, really doing a lot of self-examining, digging down, get to that etiology, the roots there. CBD treatment we talked about, and then intervention. Sometimes with these disorders, sleep can be a big deal because of there's a disrupt to the circadian rhythms, and so there are treatments that focus on sleep, and then as we talked about different types of mindfulness practices and animal assistant therapies involving mindfulness and such things can be uh, effective. So, all right, guys. So that wraps up the second part of our lecture for this week on mood disorders. And overall, between the two videos, we looked at mood disorders, those major symptoms. We looked at those subcategories, what causes them, how they're treated. We examined the multipath model of treating mental disorders and how that relates to treating depression and things like bipolar disorder. And so that's what was with bipolar disorder. Thanks a lot, guys. As always, I am here for anything you would need in class. Please do not hesitate to reach out to me. And thanks for watching. I'll see you in discussions. Thanks. Bye.